Companies that provide assistance to the elderly are juggling their operations as the pandemic continues. That's the case for Home Instead Senior Care here in Windsor-Essex. The changes they're making are extremely challenging for clients and the care provider as well. With more, I'm joined live by CBC's Sanjay Maru. Sanjay, what have you learned about how their clients are being cared for right now?
Well, Chris, there are fears around who clients want to allow in their homes. To give you some context, more than half of Home Instead's clients live in private residences, others in retirement or long-term care facilities. And Home Instead workers usually go to them to help however they might need, like housekeeping, maybe even just talking to them, keeping them company. Now, we know the province has placed limitations on where long-term caregivers can work to limit the spread, but even still, there's a lot of fear out there. That's why a lot of Home Instead's clients are canceling their appointments with their caregivers because of the threat of the virus. That's exactly what Erica Stevens-Abbott did. Both her husband and her mother are clients of Home Instead. He's 73 and her mother is 93. Now, with her mom living at the Sunrise Retirement Home on Riverside, she doesn't have family around right now. No visitors, and now, since her mom's Home Instead appointments have been canceled, Stevens-Abbott says it's left her mom feeling extremely isolated.
When you get to know somebody who comes to see you one-on-one like that from Home Instead, they become kind of an extended family member. I don't mean to be gushy. I'm just saying it's a feeling of security. So I can't replicate that feeling with however great the staff is there, however mom knows them. It's just a feeling of security and normalcy. So that's the biggest gap for me.
Now, unlike her mom, her husband lives at home with other family in the house. Stevens-Abbott says he's doing all right without Home Instead's care for now, but her biggest fear is if her husband were to suffer a fall. Now, that happened last year, and Home Instead was there to provide nursing care. If that were to happen again, Stevens-Abbott says she's not sure how she would handle that.
You mentioned a lot of clients are doing what she's doing, canceling those appointments with caregivers, afraid of this coronavirus. How's that affected Home Instead's operations?
Well, Chris, those cancellations, along with some caregivers taking time off, have resulted in a 50% reduction of staff. Now, for those caregivers who are still working, they're only allowed to work at one specific location, but that does pose another challenge. If, for example, a client requires care for 8 hours a week, they would have to be matched with a caregiver who is okay with only working that amount of time. Combine that with the fact that some clients need higher levels of care than others, and you've got a very challenging situation.
So in some instances, we've had to move some things with some clients around so that we can help them, at a different day or a different time, because we have to manage things as best as possible. So, once clients have canceled services, if that caregiver still wants to work, we put in with new caregivers, and it's been a real challenge from that perspective.
Now, Jershi also says some Home Instead staff have been tested for COVID-19, those who have worked at a long-term care home where an outbreak has happened. So he's hoping for those test results to come back soon, because they won't be working anywhere else until they've been cleared. In the meantime, however, Home Instead is exploring multiple options to continue providing care however they can. For example, daily or weekly companion calls where a client could speak with their caregiver over the phone to offer some comfort at this time. Chris.
A lot of changes for a lot of people. Thanks for this, Sanjay.